I clearly forgot about that. Thank God. Mm. I'll make a quick phone call, you guys, okay? Okay. All right. Okay. All right. So let's talk about and billing. Kanisha, remind me that I owe you 5 points. Oh, she's not here yet.
No, it's not here.
Okay.
You want me to show her?
You can let her know for me when she get back.
I'll just put Anisha. When you give me the half with your point.
You have to see what she says. Okay. Now, in chapter 5 and 7, relational, chapter 5 and 7, relational. Now, you have where the procedure codes have to be categorized accordingly.
for proper reimbursement. Okay, now, in the procedure code book, which is the CPT, it's broken down into categories. It's broken down into categories. Okay, you have the evaluation and management, which is E&M. You have surgical codes. You have radiology codes. You have pathology codes. Okay. You have medicine codes. You have chiropractic, and therapy codes. Therapy codes, okay? All right, therapy codes. All right. Okay, now, valuation and management. So we talked about chapter 7. I'm kind of all over the page. I don't mean to be. Okay, now your evaluation and management codes. Remember I told you that they have different variables to determine patient level of care. Okay. One could be high complexity. One could be low complexity. One could be straightforward. One could be moderate. Okay. Some can speak to 5 to 10 minutes. Some can speak to 15 to 20 minutes. Some can speak to 25 to 35 minutes or 30 minutes. And some can speak to 40 minutes to 60 minutes. Usually the last number digit of an E&M code determines the level of work, care, and review of systems seen about the patient. Okay? Now, let's give an example about what I mean. 99201. 99202, 99203, and so on. All of these last digits speaks to how much money of time was spent with the patient. Okay, now you also have where there's a level of time for physician assistants, nurse practitioners, and doctors alike for acute care, long-term care, hospice or home health or hospice care, to determine different levels of care. Okay, let me give you an example of inpatient. 99221, 99222. Again, it's those last number digits that's going to tell you. This digit may mean that this is $250. Uh-oh. $250 that they came and saw the patient 7 o'clock that morning. How you doing? Let me see your chart. Okay, I see all your vital signs look good. You feeling okay? Did you have breakfast? Oh, they're going to give you breakfast in a minute. Okay, let me see if you have fever. Oh, you didn't have any fever. Okay, well, it says that you're 99.1. You have a slight fever, but you're okay. Okay, well, I will come back and check on you tomorrow. You have any questions for me? Okay, well, thank you so much. Residents, did y'all see? Da, 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 da. Let's note in the chart. Da, 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 da. And we understand that the patient is doing well. See how good she looks. Her skin color is all intact. Blah, 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 blah. She had this kind of procedure done. Da, da, da. Please read along with me. Da, 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 da. Okay, thank you, ma'am, so much. We'll come back and see you tomorrow morning. Okay, residents, everyone, follow their attending outside. We're gonna have a conversation about this patient's chart. Da, da, da. And y'all sometimes see a whole bunch of residents, like I see on Grey's Anatomy, they all coming in. I brought some students. Do you mind if they come in and observe? And then normally the patients say, yeah, I don't care, or yeah, that's fine. Okay, that's what they're doing. They're training them how to view you. So when they start rotating in the hospitals from their physician offices, they know how to see you right quick. Sometimes they'll know how to see 10 patients in 1 hour and still make it to see the 9 o'clock patient in their office or 10 o'clock patient in their office. Okay? All right. $250. Okay. You may be one of those patients that like to talk and say, I don't like my nurse and I don't like how she treat me. She kept turning on all the blasted lights on at night. I'm trying to give me some sleep. She keep wanting to check my vital sign. And when I ask her for a cup of ice, it takes her all night to bring me a cup of ice. So he got to sit there and hear it. Okay. That's going to be $500. For him to hear you talk about how much you didn't like the night nurse. He got to hear that. That's $500. Keep talking. Keep talking. That level gonna go up every time. Keep talking. Yeah. Level 3. Really? Okay, but ma'am, this about as much as I'm gonna charge, so I gotta go. Okay. They're gonna talk to the nurses and leave all that with the nurses to understand. Okay, so there's different levels of the CPT book. Okay, we're gonna talk about place of service codes. Okay, so I guess I scoot it over here. Can I erase this? Okay. Kanisha, remind me that I owe you 5 bonus points. Your friend, Dr. Sunshine.
Oh, I took a picture of it, don't worry about it.
You what now?
I got the picture of it. Don't
You
worry.
got the picture of it? Okay. Well, she was gonna try to ask you for a piece of your bonus points. But that's up to you if you want to give Dr. Sunshine a piece of your bonus points. Now she asked for a half, but I'm trying to give you heads up. You know, you may want to give her a piece, not half, just a piece.
With your consent.
Okay, that'll work. All right. Place the service code. Modifiers. Okay, place the service code. Modifiers. Something else on there. See a picture of the scene. Place the service code. Somebody. Should be 1400. In here, there it is. Okay. Diagnosis pointers and units. Okay, unit significance to anesthesia codes, number of visits, number of items. Okay, number of visits could be to office visits, office or hospital room visits. Okay. Items can be significant to home health, materials, vaccinations. I hope I spelled that right. Okay. Oh, therapies. Hold on just a minute, sweetie. Okay, what was your question? home health materials. I'm sorry. That's an M. That's an M. Materials. And I explain what I mean by that. Diagnosis codes, meaning the time of anesthesia, or sleep, sleep medicine given. Okay, sleep medicine given. Okay, and I explain what I mean by that. Sleep medicine given. I explain what I mean by that. Okay. Diagnosis pointers. Diagnosis pointers have to be, they point specific to diagnosis codes to match procedure codes in sync. Okay? In sync. When we get ready to talk about the CMS 1500 form, I'll explain to you what I mean. Okay? I'll explain to you what I mean. Okay, modifiers. Modifiers, they give a description to help emphasize the use of procedure codes if needed to further explain a repetitious procedure code use for same day or outstanding procedure, and I'll give you what I mean by that. Okay? Place of service codes tell where the health service took place. Where the health service took place. Okay? Did it take place in a birthing center? You know, instead of the mother giving birth to her child in a typical acute care facility, she decided to go to a birthing center, okay, or a midwifery center. Outpatient, 22. So let me give you some examples by that. So 11 is for office visit. 22 is for outpatient, surgical, let's see here, physical therapy, all therapies at a facility. Okay. 23 is for the emergency room. 21 is for the hospital. acute care. I think it's some of them. It's a whole list of them in that CPT book. We'll go over, but these are some of your most popular ones. These are some of your most popular ones. 11 is popular. 22 is popular. 23 is popular. 21 is popular. Okay, it's a whole list of them. There's different modifiers used for repetitious reason and requested procedures, and also, side note, anesthesia. I hope I spelled this right. Please forgive me. Has its own modifiers. Has its own modifiers. Okay, we'll talk about that. We'll talk about that. Okay. Medical necessity. I think I've talked about medical necessity once before in that meeting diagnosis. I think I talked about that one before. Okay. Let's look at page 127 in your handbook, your insurance handbook. Okay. So on page 127, so on page 127, you have the ICD-9 and the ICD-10 book. Look at example 5-2. Okay, now you have in the ICD-9 CM book, you have 461.9, which is acute sinusitis unspecified. Translated into the ICD-10 CM book as J01.80. Okay, what's the difference? I'm glad you asked. They use alphabets to better tabularize what section to find that particular chapter of illness, okay? And they do that to help specify different parts of the body, okay, when they give alphabets, okay? And so it makes coding a little bit more specific, meaning if they say the right ear, that alphabet is going to list in that chapter with those numbers where located anatomically are they speaking of, okay? And it's going to tell them a little bit more specific than what the ICD-9 has. ICD-9 is just numbers, no alphabets, just straight up numbers, okay? I'm going to teach you about the Hicks-Picks book. That's a whole different book from the ICD-10 and the CPT. But in the ICD-10, it has the alphabet and the rest of them are digits with a placeholders. Okay, I call them anchors. That's how I see it in my head as anchors, but they're known as placeholders. Okay, now look at the example in 5-2, 461.9 acute sinusitis unspecified. Then you have J01.80, which is other acute sinusitis, J01.90, which is acute sinusitis unspecified. Then you have J01.91, acute recurrent sinusitis unspecified. And then you have 470, which is a deviated nasal septum. And the ICD-10 diagnosis code interpretation is J34.2, which is deviated nasal septum. It's the same thing. The crosswalks are not exact and may not always provide a one-to-one correlation, but can assist in finding appropriate code ranges for reporting purposes. Okay. Now let's look at the J01s, all the J01s. You see how the ending is in 80, 90, 91. Okay. So if the physician writes a diagnosis on the board and he says acute sinusitis, and he did not specify acute sinusitis, you can use the code J01.80 or J01.90 because it's unspecified and it says other acute sinusitis. So both codes still kind of leaves a broad use, if you will, for either codes, and that's fine. You won't get rejected for that. Okay. If the doctor says the patient has reoccurring acute sinusitis or acute recurrent sinusitis, then you know to properly, because he documented that in the SOAP notes. Where do we live in the SOAP notes? Where does our job live in the SOAP notes? In the SOAP, where do we live? A means subjective, objective, assessment, and P means plan. Very good, Athena. So we all live, our job requirements live where? In what part of the SOAP notes, where do we live? A, assessment. We live in A. Okay, very good. So documentation, ladies and gentlemen, is everything. Everything. You can't add to it. If the doctor says acute recurrent sinusitis, then you code exactly what he wrote there. Okay, or you utilize exactly what he said if you're scribing for him or the nurse is scribing. Scribing means he or she is typing up information in the electronic health record because she's doing that. All he wants to do is care about the patient. He don't have time for that cute stuff in the computer. Okay, that's your job. Okay, all right. Now, if the doctor puts in there and he says acute sinusitis, you cannot go in there and make a decision on the doctor's behalf. Talking about, well, it's last time it needs to be recurrent. No, you have to code what he said because his word is going to stand over your word. Why? Because he's the licensed medical professional. You are the certified administrative professional. You don't deal with clinical stuff. He does. You do with the administrative stuff. Stay in your lane. Stay in your lane. Stay in your lane. Stay in your lane. Everybody got that? Okay. All right. Now, that's what my sister said. Girl, I use that all the time. I'm gonna stay in my lane. I ain't moving nowhere. Stay right there. Okay. Now, let's go to page 128. This is how it normally looks in your ICD-10 books, okay? The bottom here, the bottom figure 5-3 is how it normally looks in volume 2. Volume 2, again, is going to be the first place where you're going to find that disease or condition, okay? Volume 1 is what this looked like up here, 5-2. That's volume 1. So the first place you're going to look at is where? 2. Where you going to verify? Very good. Do we do anything with volume 3 in the physician's office?
No.
No. Very good. Where do we do that work at? Okay, something billing. We build web with volume 3. Where do we do that work at? What facility?
That's an acute care.
At the acute care hospital. Acute care means what?
Like long term.
You point at Athena. She waiting on you to help her out, Athena. Okay, inpatient. Acute care means inpatient. It means inpatient. So volume 3 is only done where?
In the inpatient acute hospital.
In an inpatient acute care hospital facility. Thank y'all so much. Should you ever look at volume 3 in a physician's office? No, never, ever. Never, ever. Like Chris Tucker say on Fridays. Never, ever. Do volume 3 in a physician's office. Okay? Okay, she said, okay. If y'all looked at the movie Fridays with Chris Tucker, you know, you get what I'm saying. He's so funny. But anyway, y'all. All right, now let's look at this. Let's look at figure 5-3. Okay, this says index to diseases and injuries draft. So look, this word is anemia. Okay, I'm gonna erase all this off the board. Y'all got this? You know what? I'm gonna start with this over here. Yeah, I'm gonna start with this over here. Because I'm gonna need that for a minute. Okay. Now, looking how you should look at the volume 2 in your ICD-10 book. How you should look at that. Well, first, you're gonna look for your condition and your disease and or disease. Okay. By the main term. So you have the main term, then, well, not this part. Then you have the sub-term. Then you have the sub-term of a sub-term. Then you have a sub-term of a sub-term of a sub-term. And then you have again. So sometimes it may go to even to the 4th level to be that specific. Now, sometimes on those lines, you may have what is called a carryover. Okay? And over here, a carryover. Okay? And again, along with these, you may have, not all the time, but you may have carryover. And I'm going to explain what that means. Okay? Side note. Carryovers are sentences or words expressed to explain the diagnosis, that's a D, diagnosis code discovered. Okay? it is not to be confused as the diagnosis code in sentence structure. Of itself. It's for details only. Okay? All right. Now, you have main term, subterm, subterm of a subterm, and so on and so on. Notice how it goes at an angle. Pay attention. That means all of this falls under the subterm. Okay? Now, let's use one for an example. What's that A word that they have on there? What's that A word? Arthritis? Anemia? Okay, anemia. Okay, and let's do this. Sickle cell anemia. That is a diagnosis. Sickle cell anemia. Okay. Now, the condition is anemia. That is the condition. But what type of anemia is it? What's the adjective? What's the adjective? Sickle cell, okay? Sickle cell is the adjective. Okay, we're going back to grammar school, pre-K to 12th grade. Now y'all understand why grammar school makes sense in college now. I say, why we need to learn all this? Yes, it is, because you need to understand what kind of a condition of anemia this is. This is sickle cell anemia. There's different types of anemia. Okay? So we need that adjective to further explain in specific what that is. Okay, now, this is considered the main term. All right? Now, who found or who can find is sickle cell anemia on that list? No. Let's just pretend. Okay, so let's pretend that this is anemia. This says blood type, and it's an example, y'all. This is not real. Blood type anemia, and this may say sickle cell anemia. Okay, now see that slant? This is the main term. What would this be listed as? Subterm. What would this be listed as? Subterm. Of the subterm. Very good. Thank you, Miss Allison. Subterm of a subterm. Are y'all getting this? Very good. Okay, now let's use an example that they have in the book. Okay. Okay, very good. So they have anemia, they have hemolytic due to, and then they have enzyme disorder. Do y'all see that? Now they have a subterm and then a subterm of a subterm. See how they skip due to? Let me give y'all the rules of due to. Let's see. So, with, due to, those prepositions. I'll come back to it. Anytime you have diagnosis code expressed in words such as blah blah due to blah blah with or blah blah within. Sometimes this is going to tell you 1 to 2 codes. 1 to 2 codes. Sometimes this is going to be an adjective to explain something, that underlining, or sometimes it's going to tell you bronchitis due to upper respiratory infection. When you understand coding rules and coding guidelines, you're going to understand, okay, I need to use both codes, upper respiratory infection and bronchitis. Or if you happen to code it and you go to volume 1, it's going to tell you use either or use a manifestation code. So it's going to tell you, okay, the manifestation is bronchitis, but the underlying disease is upper respiratory infection. Okay, those kind of things. With it does the same thing, 1 or 2 codes, does the same thing, 1 or 2 codes. Okay, so we're gonna practice with some codes like that because I really want y'all to understand how to properly utilize that. Okay, now they skip due to on there because due to is part of a carryover. Okay, it's part of a carryover. And so it's explaining due to something, okay? Due to an enzyme disorder, due to drug-induced presence of shunt or other internal prosthetic device. That's that carryover right there. Because it's further explaining something. That's what carryovers do. You guys see the presence of shunt or other internal prosthetic device? That's a carryover sentence. It's just a long sentence to explain the diagnosis, and then it gives an ending diagnosis code. Does everybody understand that? Okay, fantastic. It's gonna make coding so much easier. Okay. Now, let's go to let's go to okay, here are all the chapters. Let's look at page 131. Let's look at page 131. Oh, this is good. This explains everything. Oh, this is so good. I need to tell my night class about this. Okay. Sometimes I let my night class watch the daytime videos that I do. Kind of saves on a lot of airtime. Okay. So looking at page 131 and chapter 5 of your Fordney book, see all these beautiful chapters. You have chapter 1, infectious and parasitic diseases. Chapter 2, neoplasms. Neoplasms are a, how can I say? It's a chapter within volume 2 that's a chapter all by itself. It has every morphology, just about every discovery of different cancers. Neoplasms mean cancers. Was it benign or was it metastasized? Let me explain that on the board. Neoplasm is a chapter by itself. Okay, in volume 2. Okay, now they have neoplasm means cancers or tumors. Okay, now they can either be benign or metastatic. Metastatic. Benign means non-cancerous. Metastatic means cancerous. Okay? And then sometimes the word metastasized means that the cancer has spread. The cancer has spread it, okay? Metastasize means that a metastatic means that it's cancerous, it is there, it exists, okay? Metastasize means that it has spread, okay? Now, this is going to speak to different levels, and since we are in the pink month, pink is the new fall color. Like the pink girl, pink is the new fall color. Okay, now, you have some that are primary. You have some cancers that are secondary. You have some cancers that are tertiary. How you spell it, sweet?
T-E-R.
T-E-R?
Tertiary.
Oh, baby, come on, Dr. Gabriel, talk to me. I've been waiting on you all week. Okay. What is that?
R.
T-E-R.
T.
T-I-A.
A. R.
All right. Thank you, Dr. Gabriel. Thank you. Okay, tertiary. So primary, secondary, tertiary, and then you have some that are in situ, and then you have some that are unspecified. You know, you have those rare cancers. They know it's something that's eating at you or something that's tearing away at your very being, your cells, but they can't quite put a face to it or a name to it. They just know it's something, and we're gonna try something to see what we can do to get to that something. Okay, very good. So now we have the primary cancer. So primary cancer is first discovered. First, and sometimes the only discovered cancer. Okay? Secondary can be due to the first discovered. Okay? Tertiary is due to the second discovered. Remember when I told y'all about underlying conditions and how it branch off other diseases? Okay, so you have again primary cancer. Primary cancer. Okay, now the person is in remission. Okay, now let's suppose that the cancer came back. Maybe it's in the left breast. So primary cancer was in the right breast. It's found in the right breast. Some kind of way that cancer traveled in the thoracic area. Remember, we learned in anatomy physiology, medical terminology, right? It traveled over to the left side of the thoracic area. Okay, so now it came back again in the other side of the breast. Okay, now let's suppose that it travels to the brain. They got this in remission now. Okay, so this is in remission. Oops, this pops up. Third, tertiary. This was found in the brain, perhaps, or in the liver, perhaps. But it's that cancer cell, it traveled from one place to another. But it all comes back to where it first what? Began. Okay? Sometimes it triggers like that. It'll trigger in another place. Okay? And so I have an aunt right now that, God bless her soul, she's a 3-time cancer survivor. The first was in her lungs. The second was in her throat. And the third time in her bladder. Okay? But it all came back in where it was first discovered. So you can be in remission, and there are some folks that be in remission. Healthy, strong, and in remission. Okay? But sometimes happenstance due to environment, sometimes due to stress, if you don't do enough self-care on yourself. And I'm not saying self-care is eating a lot. That's not self-care. Self-care is making sure that you rest, you stretch, you go walking, you do yoga, you have meditation time. We grew up, my mother gave us a strict, how can I say, regimen. And she would allow us to watch cartoons early in the morning, and then in the afternoons, about 11 or 12, it's time for her soap operas. So she'll sit us outside in the backyard, and we'll play softball or whatever with one another. I was always into gardening. I mean, I play with my brother and his friends because I had crushes on his friends. So I like to play flag football with his friends because I liked one of them, well, 2 of them actually. And I just wanted to be outside and look at them, and play. So anyway, did that. And then, so right around 1 o'clock, it was one life to live. We all knew 1 o'clock was nap time. That was nap time. Get your snack, eat, lay down, watch One Life to Live with Mama, because eventually at some point you're going to go to sleep anyway because it's not interesting to you. We go to sleep, 3 o'clock, we wake up, she'll fix us peanut butter and jelly, or she'll fix us some cookies. We have some snacks. We would eat, or sometimes we have a mayonnaise sandwich or a mustard sandwich. We'll have us some snacks. And then she would cook dinner and have it ready for 5:30 before my dad came home. Okay, so that's the kind of regimen she had us on every day, especially during the summer. She had us on that kind of regimen. So she did something, what I'm explaining is, she knew how to put us on a regimen that when we went outside to play, she had some Mimi time. We weren't mama, mama, mama. But sometimes we would come in and out the house. That was at that time when water was safe to drink out the water hose, out the hydrant. Now it's like everybody's into this bottled water. Everybody's into the bottled water now. We done got away from the water hydrant. Okay. So she would tell us, and the water be cool coming out the hydrant. It wouldn't be hot. It would be cool. Y'all stop coming in and out of my house. Y'all stay outside. Either you stay in or stay out. We knew, okay, we want to have fun, so we'll stay out. Right? We had a patio. We had trees, and we knew how to conduct ourselves. Okay, so we play. We'll drink from the water hydrant. Play, drink from the water hydrant. And then we come on inside, and then we would go to sleep. Okay, so again, my mother knew how to self-care. She knew how to put us on a regimen. And at that time, somewhere she knew 1 o'clock, okay, kids asleep. Ooh, I could read my Harlequin romance novels. Ooh, ain't nobody pulling them. I can focus and romance in my head. Okay, then we wake right back up. Okay, they're gonna be hungry. Peanut butter and jelly sandwiches, jelly cake. Everybody remember jelly cake back in the day? Nobody remember jelly cake? Oh! Okay, well, my mom was from the country. Okay, my mom would make pound cake, and she would a thing to ask anyone in my generation is when you get home, jelly cake, and they're gonna tell you, just Google it, jelly cake. My mother and my grandmother, Mama Dear, they would make a pound cake, and they would just use simple jelly preserves, grape jelly, apple jelly, guava jelly. Fig, we make preserves. My mother, we have fig tree. We make fig preserves.
My mom makes it now.
She still does? Okay, okay. We grew up doing that. We grew up doing it. And they would put it on the cake. Is it true? Yeah, yeah. We had that growing up. Like my mom would make a bundt pan of it, or she'd make a 2-layer cake with the jelly in the middle. And my dad loved it. It was great. So we grew up with that. We would have that. My point is self-care. When you have kids, nieces, nephews, grandchildren, whatever, you have to strategize a way to have some me time. Okay? I do that with my nieces, my nephews. I take them to the park, especially the Herman Park. I'll take them to the Miller Outdoor Theater. Everybody been to the Miller Outdoor Theater? Mm-hmm. Okay, they got that hill. Mm-hmm. So I'm gonna pretend I'll be like, okay, y'all, I'm gonna race y'all up the hill. Y'all ready? Set, go. And I stand right there. And they, and then they say, wait, what? I said, yeah, y'all won. I come back down. And I said, okay, I'm gonna race y'all again. Y'all ready? Ready, set, go. And I was standing right there. And they were, we beat you again. I was like, yeah, sure did. Y'all come back down. I would do that to them about 5 good times. 5 good times. Then I would take them to the house. And I would give them a turkey sandwich because turkey has serotonin in it. Pineapple juice is natural. They would have turkey sandwich and pineapple juice, and they would take a nice long nap. Those natural remedies to wear out your kids. Mm-hmm. Oh yeah, outside. Mm-hmm. Outside. Mm-hmm. Works every time. Mm-hmm. So if you don't do self-care stuff, you'll wear yourself out. And sometimes environment will trigger it, stress will trigger it, bad eating habits will trigger it, different other habits of life, your social history, your social history is like when you go out to the clubs, what you drinking, what you smoking, what you doing. Those kind of things tend to affect triggers of cancer. Every one of us has a teeny tiny flea size of cancer in the body. It all plays up to environment, stress, or heredity that causes that cancer to trigger. It doesn't necessarily mean because Big Mama have it, you have it. No. It may skip you and go to somebody else. But if you understand and study your family pathology of sicknesses and disease, you can help better take care of yourself than the previous predecessors or your previous relatives. Am I making sense, everybody? Okay. All right. And then, the Industrial Revolution, all this processed foods and processed sugars and processed flours. Then they got rid of a lot of the natural things and this GMO stuff, So I think too, environmentally, that plays a role in some of the cancers compared to what we had before World War I, World War II, because it wasn't all that before. Diabetes was not huge. We had bubonic plague, we had measles and tuberculosis. We didn't have a lot of diabetes or cancer and stuff. If it was so, it was a rare thing. It was a very rare thing. It wasn't as rampant as it is now.
Because most of your vegetables and fruits came straight from the ground.
That's right.
They didn't use any preservatives on it. They ate it, whatever they picked from their garden, they ate it at that time.
That's right.
Nothing was preserved.
That's right.
So now it's being preserved to last longer, which means, and now with all this cancer stuff, I think a lot of it comes straight from all the preservatives that they're putting in these fruits and vegetables.
That's true. That's true. Pesticides.
Yeah, exactly.
And you call that
Right. Right.
Your backyard, that is organic.
Right, the ones, right.
And one thing more I want to share, I read it. The warm water, you put the lemon, much better. It's a warm water you drink. It's anti-cancer.
Oh, okay. I have some lemons at my house. I have some lemons.
Much better you drink. It's a warm water. It kills the cancer cells.
If you drink it warm, not cold.
With lemon.
With lemon.
Oh, okay.
Okay. Thank you, Dr. Sunshine. Appreciate that.
And every time I eat, I put 1 tablespoon of apple cider vinegar.
Yeah.
How much better you use the apple cider vinegar, the organic?
Yeah, I buy the Brags in the glass bottle.
Right.
You know, it's much better in the glass bottle
Yeah.
than it is in the plastic.
Right.
Mhm.
And now they sell them like in a box, I think it's
And-
like 6 little big ones or 3
And the water
It's
is
in a
one,
box now.
Oh,
And
really?
it's in a glass jar, but they look like
and the
small
water is
glass
one,
jar.
if you're in the car, don't let lid in the car.
Oh, get where it
It's like
warm,
it's
get,
considered-
right,
it-
right, I
it's
heard
getting
that
warm,
too.
this one,
Yes.
I
and
heard
it's
that
better,
too.
it's cold.
Yes, absolutely. Yes. I have like 3 or 4 bottles in my car right now. I'm just guilty of that. Ooh, I'm guilty of that. Yeah, but I don't drink them. I just have them there. Sometimes me and my husband, you know, between church services or errands we running, we like to like pull over and I'm like, "Ooh, which one is it?" You got some water to kind of rinse off the food or whatever off your hands. So yeah, you're right. And that is so true. That is very, very true. Thank you, Dr. Sunshine. Appreciate that. Thank you. Yeah. But so those are some of the things. Benign means non-cancerous. Sometimes there could be a lump, like it was for me when I was 24 years old. There was a lump in my right breast, and it was benign. Then at 43, 19 years later, it came back and it was cancerous, you know? And that was 2012. I noticed it started developing in 2011, but in my mind, I'm thinking, oh, it's just another benign tumor like it was when I was 24, no big deal. But I'm so glad I got insurance. You know, I went back into teaching and got insurance and got myself checked and it was cancerous. It was stage 2. Stage 2, got it right on time. Okay, so neoplasm has its own thing. In situ. In situ means, no, let me use red. In situ means that primary discovered, but traveled elsewhere for diagnosis. Okay, let me give you an example by what I mean by that in situ. Okay. My dad some of his family members say he was a smoker since the age of 14. He was young. Some of my family members, my mother and all knew he was a smoker since the age of 21. So he's either 14 or 21. No one could really kind of tell. And he worked at a butcher shop. He worked at B&W Meat Market, right there off of North Shepherd. Anybody been there? B&W? No? Okay. Well, if you ever go to B&W Meat Market, right there off of North Shepherd near Pine Mount, my dad was their butcher when he was in high school. My dad went to Cashmere High School, so he was their butcher. So they've been around a long, long time. And so anyway, so my dad in 1980, I think 6, when I worked at Dr. Moscar's office, this was my last year of high school. And my dad hurt his hip. And so he kept playing about his hip. And he knew I was going in a nursing and he knew I worked in a doctor's office. So of course, he's going to ask me questions like I'm a physician, right? And I'm going to tell Daddy, you know, everything. So I told him, I said, well, Daddy, let me make an appointment and let you come see Dr. Moscar. And then, you know, maybe, you know, he give a lot of his patients injections. Maybe he can give you an injection in your hip and you feel better. You know, he goes, okay. So I made him an appointment. He came up there one day a little early after work, after he got off from work. And he said, well, I need to do an x-ray. So Dr. Moscar did an x-ray of his right hip to see what was going on. If his bones was deteriorating, you know, if he has arthritis, you know, so he could properly diagnose him. And while he had an x-ray machine inside the office. So we did our own x-rays. We had a physical therapy department. We had our own little lab in the back. I mean, it was the coolest office I ever worked at ever, my senior year of high school. And so So my dad did his x-ray, so they put him back in the patient's room, and then my dad was, he was, looking, he was an Indian doctor, so, he kind of talked, and, you have to really, really, really tune in. So I was like, okay, well, what's going on? What's going on? He says, come in. I said, okay. So I came in, sat with my dad. He says, Mr. Glover, you nodules on your lungs. We caught that during the x-ray, because when a person does an x-ray of the hip, you can't help but get
Right.
the lungs. You can't help but see that, right? So he noticed the black spots. So he told my dad, and my dad was like, oh, okay. Well, you got to stop smoking. You got to stop it. And my dad was like, okay, all right. He hear him, but he ain't,
Right.
And so anyway, so then he hear him, and then he says, no, this is very serious. That could be cancerous. You need to stop it. And he says, okay. What about my hip? My dad was a workaholic, So I pretty much got a lot of my dad's DNA. Just got to, okay, what you gonna do about it? Okay, fix it and let's go. Fix it and I gotta go. So he gave him a shot. And then, shortly after, my dad was taking a lot of vitamins and a lot of aspirins, just trying to really help himself healthily instead of going out further. I can't remember if Dr. Moscard, I'm sure he's very, very old now, really, really old. But anyway, retired. Either he referred him out or whatever, but I know he talked to him diligently about it and had him to come back for a second visit to talk to him some more. When you gonna give up that smoking? So anyway, this is 86. Speed dialed to 93. I worked at no 94. I worked at MD Anderson. I was still working there. And then they were laying off people. They were letting go people. So I was one of the ones that got let go. And I came home early. So all of a sudden, I noticed somebody was coming through the door. It was me. I was like, oh. And he said, what you doing here? I said, oh, they let me go at work. He got upset. I was like, oh, okay, I felt bad. And I didn't understand. And then I'm like, how you doing? In my mind, you know better. You cannot ask a parent what you doing home early. That's their house. They pay the bills of the house. You can't ask them that. You just a resident, okay? So I was kind of slick. I was like, well, how you doing? I noticed you, well, they said this, they found this. I hurt myself at work. I said, okay. So now I looked at it, and he said, doc says this diagnosis here. What's this? And I explained, and me being a new patient registration, a registrar working at MD Anderson, I knew when I saw that diagnosis what that meant. It meant metastatic lung cancer, nodules. When it said nodules, that means cancer. And I said, oh my God, Daddy. And then I had a workers' comp for justice license, so it all came back to me. I said, Daddy, this is serious. They said they want me to see an occupational doctor to see if it's degenerative. I heard myself, well, he was just concerned about not being on workers' comp, because he did not want to be on workers' comp because he wanted to work, And so anyway, so we did that. Long story short, he was diagnosed with lung cancer. But my point is, in situ was that it was found when he injured, supposedly, his back, okay, and he hurt or re-injured his hip. Now, all this was on the right side, okay, so he injured his back. They found out conclusive that his back was due to degenerative disc, okay? And the hip was also degenerative, meaning that it's degenerative due to the nodules And the nodule is explaining it to be what? Lung cancer. Okay. Now, he found these nodules in 1986. And he hurt and injured himself in 1994. So what is the time span between that? Is it 2 years or 8 years?
What is it, 86 to 94?
Uh-huh.
6 years.
It's 6 years?
96. You say 86
Yeah.
to 94?
Uh-huh.
Yeah, that's 6 years.
You sure?
86,
50.
you said
Yes, 8 years.
8 years, 8 years.
Yeah.
Okay.
Yeah,
I think
8
it's
years.
6. Okay.
Yeah, 8 years. So it's an 8-year time span. Okay. So I believe when it was first discovered, the nodules in his lungs in 1986, and I remember my dad was always, how can I say, taking aspirins every day, 1 or 2 aspirins every day, taking Geritol every day, taking vitamins every day. I think it helped. I think it helped. Let me explain why. I think it helped because on a natural sense. Let me speak about natural. What I mean by natural, in my understanding of natural, was over-the-counter medication. Okay, an 8-year time span, he knew how to go and do over-the-counter or naturalistic things. Usually, and when they found the lung cancer and he hurt himself, he was stage 3. Okay, he was stage 3. This was diagnosed again in 1994. Now, let me explain my pathology. Mine is stage 2 inductal carcinoma, breast cancer of the right breast. Okay? Now, 2010, my mammogram was normal. Normal. No predisposition findings, no nothing. Okay? Now, let's go back to my history. My history is that, again, in 1994, like my dad, how funny. 1994, this was in June, as a matter of fact. I think this was June 24. I remember, because my dad had his surgery, and then I had my surgery. My dad had his surgery first in June 94. His was discovered April 6th. I'll never forget, because April 6th was the day that they laid me out. Really, they fired me. We'll talk about that. But I'm going to be cute and say they laid me out.
Yeah, okay.
We'll talk about that. That's a whole nother conversation. But I was redeemed in 2012. That's a whole nother conversation. I know HR skills really good. Mm-hmm. Okay. So June, I want to say this was about June 23rd, okay, is when Tara had her surgery. I think my dad had his surgery June something, but it was before mine. Okay? Now, HX semicolon. Sorry. HX means history. Remember that. HX means history. TX means treatment, not Texas. Okay? SX means surgery, not sex. FU means what? Not this. It don't mean this. FU means what, Miss Allison? FU. No, I mean, follow up with you. I want to follow up with you. I'm sorry. I had to have that sense of humor. I'm sorry. All right. So anyway, I'm glad to make you laugh, Miss Allison. Laughter is good for the soul. All right. So let's look at this again, people. All right, so I remember my surgery This is me, benign, right, mass in right breast, requested by medical necessity every year, annually, every year. Even though I was 24 at the time, when I went and got my well woman exam check, you girls, y'all need to get your well woman exam check. Oh, oh, okay, well, bless your heart. Okay, sorry about that. Okay, where I was going with that? You know, that is so funny because also in 1994, my aunt, I'm gonna call her BJ because I don't think she want me to talk about her out loud, so I'm gonna say Aunt BJ. Aunt BJ, she was diagnosed with breast cancer. All at the same time. So my daddy was going through his cancer cancer biopsy. My aunt was going through her breast cancer care. 1994 it seemed like was a very eventful year. Very eventful. But mine, I didn't think much about it because I was in, like I told you, did I tell you that I was in 5 auto accidents in a 5-year span? Okay. So it was like every year. So it was like my husband when he like, oh, Sunday, yeah, we were running errands, going to the grocery stores, going to get stuff to eat and stuff. And he trusts in brakes. He trusts in brakes like he trusts God. That's good. I mean, that's good. But I don't put my faith in my brakes. I put my faith in God to give me the wisdom and tell me, stop. Because how do I know that car in front of me is not a stick shift? And they trying to, sometimes they play around and, you know how, I don't know how to drive a stick shift, but I had an ex-boyfriend that had a BMW. And he would just play like that, you know? So I'm very cautious. So I love to give myself room, you know, in case somebody rolls, you ain't rolling back into the front of my car. And I don't like when people drive behind me up close because I get paranoid. I'm very, I think I had my godmother in the car with me. I would literally pull over in a median of you know how you have those medians where you can make a turn? Mm-hmm. You can sit right there and make a turn until everything clears. I would literally pull over. And she goes, what's wrong? I think that person was riding on my bumper too much and I'm trying to tell them in the mirror, stop, get off me, get off. Okay, they're not hearing me. And she goes, you all right? I said, I just get paranoid when people ride up on me like that. And so my husband don't quite get it. I said, I've been in 5 accidents in my early life within 5-year span. So sometimes I don't, you know, and I don't do that with everybody. If I can sense and feel you a safe driver, I'm not gonna do that. But if you want to know them risks, and I could be a crazy driver now. I know when to be crazy, but I know when to be safe at the same time. But he just, and I'm like, and so we were like inch from this lady's car. I said, this is gonna be my last time. You not driving my car no more. You drive yours. Because if you want to tear yours up, I'm good. Because I'm still gonna ride. Beep, beep. I'm still gonna ride good. You the one gonna sit there with a boo-boo look, trying to figure out how to get to the next car. Because I ain't doing it. I value what I have. I treat what I have as if I'm not gonna ever get another one again. Because I know the struggle to get that item. If you understand the struggle and know the struggle is real, when you get some, you're gonna know to take care of that and stop being so wasteful. So anyway, where was I going with that? I was on a rant. Sorry. Okay, so coming back to this. So this was an eventful year. Okay, so I was kind of mammograms based on medical necessity, even though I wasn't quite 40 yet, 25, 27, 26, 30, 35, 36, all the way up to 2010. I was 41 because I just made 40 in 2009. My mammogram was fine, but I felt that growth. The growth started happening in 2011. But in my mind, it was a benign tumor because I've had it once before, 94. Then it grew bigger in 2012. So what am I explaining? It was a 2-year span for stage 2 to occur. 2-year span. 2-year span. That was kind of fast. I had weight loss surgery. I had my first weight loss surgery. Believe it or not, y'all, I lost 100 pounds. I know it don't look like it, but I did. Thank you. But anyway, I don't care. I've been a chubby kid all my life. I don't care. Anyway, so anyway, this stage 2 happened in a 2-year time. When I look at my dad, first diagnosed in 86, in situ, found in his hip, and they thought it was a dead. And then it was an 8-year time span, and he took over-the-counter medicine, and he did the natural thing. He did better than me. Because if you got what I'm saying?
Because it took 8 years.
Yeah.
Come on.
It took 8 years for him to get diagnosed at stage 3, correct?
Yes.
And it took you 2 years to get to stage 2. So with him taking his over-the-counter meds, helped prolong the cancer.
But his, and also it didn't better the quality, but it gave him quantity of life.
Right.
The quality was still deteriorating, but
Right.
slowly.
Right.
But he got extra quantity of time, quantity of life.
Right.
Mine's on the other hand, healthy, nothing found 2010,
Right.
stage 2 found 2012.
Right.
Do y'all get that?
Right.
I wasn't doing all the, and I had other comorbidities going on in my life. Gout, high blood pressure, depression, stuff like that, anxiety, stuff like that. Okay. So where am I going with this? Okay. So with my dad coming back to that, that was such a neat technology. I gotta take a picture. Oh, that's beautiful. My God, that is beautiful. Okay. I'm sorry, y'all. I get amazed how God downloads stuff and give it to me and be like, oh, the art is beautiful, magnificent. Oh, okay. Now coming back to this in situ. So this really took place in my father's lungs, the nodules. It was found there, but the cancer traveled in his sacral area, okay? That tailbone right back there. You know how the girls like to get those tattoos?
Yeah.
That tattoo and wear that long-waisted dress to show we got a tattoo right there.
Yeah.
I don't do long-waisted dresses like that. Backless dresses. Anyway, it was right there in his coccyx area. And for it to be in his coccyx area, it affected his coccyx area in the tailbone. The tumor grew right there. So it went from his lungs, down his spine, degenerative disc, down his spine, sat right there in the coccyx tailbone, and then it traveled on over to the what?
His hip.
Right here.
Joint.
Hip joint. So the cancer initially started or came from what? The lungs. The lungs. And then it traveled down his spine. That's why he has some degenerative disc. And then the tumor sat right there. So when they did his biopsy, they did my father's biopsy. When they did my biopsy in my right breast, they did a needle aspiration. So they pulled out some of the tissue. Right, very good, Dr. Funstein. They pulled out some of the tissue into the needle, and then they squirted on they smeared it on the micro slide.
Right.
Yeah, and they could tell where the cancer or how long the cancer was, determining by the pathology of the cells, right? Stage 1, stage 2, sometimes they have stage 0. It happened to my best friend. She had a very, very fine one, but they found it. They saw the nodule, and she had a stage 0. Both both of us, we all went to Prairie View together, her and Tammy. But my point is they had better technique of determining through biopsy, through needle aspirations. When they did my dad, they didn't do a needle aspiration. They were still kind of new. I'm not gonna name the facility. I'm not gonna name the doctor, bless his heart. They went inside my dad's tailbone, the coccyx, and they opened it. O2, oxygen. He was already stage 3. So this was June 94. Daddy passed away. My mother would tell me 210. I say 29, I can't remember. But I'm according to my mom, and that's her husband. That's my dad, but that's her husband. I honor that. 210, 95. So how many months did he live? From June? No, really from April. April 94 diagnosis to February 95. 10 months. 10 months. He was 2 months from being 50 years old.
Wow. Because they opened it up.
And when I told one of the doctors that I work for at this prominent clinic in Houston, everybody knew the clinic, because the commercials are out there. Whee!
But he had no chemo.
He did have chemo. My dad had chemo after his June surgery. He did have chemo, but the chemo didn't do very much. It gave him a little bit more quantity, but in months, not so much in years.
Because my sister-in-law, she passed away last March. She had cervix cancer. And the doctor said she had 9 months to live, but 6 months.
She passed away. What was her mindset like at the whole time? How was she? How did she?
Because she had they operate, right? Take out the cancer in the cervix.
Okay, so she had
Yeah,
cervical
yeah.
cancer.
Mm-hmm.
Okay, so did they do a cone procedure, or did they do a total hysterectomy or a partial hysterectomy?
No, part only of the cervix. The cervix.
Okay, but she still had her uterus and she still had her ovaries.
Yeah, she still have the uterus because
The
the
uterus.
cervix is only on the, this is the vagina, then this is the cervix.
Yes.
Then, but the procedure, she had the chemo,
Mm-hmm.
but the cancer, one more time,
It came back.
came back.
So how long was she in remission the first time?
Like,
2 months.
yeah, then the doctor said, if you have one more chemo, the body is weak.
Yeah.
So, like her, live like that. Because waste the money,
Yeah.
Because I don't know, they stage 2,
Mm-hmm.
then it's fast going to stage 4.
Yeah. So when they did the cauterization, they did what they call the cone technique. Okay, in the uterus. So you have the uterus, okay, and then you have the cervix here, okay. And so what they did was, and if I'm hoping I'm explaining it correctly, in illustration, they did what they call a cone technique, where they got rid of this, and it kind of left it like a V. Okay. Somewhere up in there, the cancer still was there.
Yeah.
They didn't get it all out. See, with mine, let me explain you with the breast cancer. This was stage 2. Stage 2, let me draw a plain circle. Stage 2 was big as a walnut, okay? For them to remove the nodule, they had to make a bigger circumference around the cancer itself. Why would they make a bigger circumference to cauterize or remove the cancer? Because they want to make sure that they get everything. You see, they couldn't just do this and still there's a chance that the cancer, a cell or something has traveled through, right? Okay, so they had to do a bigger, so they were gonna do a lumpectomy on me. My physician, she's huge about save the tatas, you know, and I'm like, well, I always wanted bigger dudes. I always wanted to be sitting on dudes. This is my grand opportunity to be some dudes, some 26-inch rings, some real grills. Because in school, I had lost 144 pounds in high school. So I was a size 10 and 11. And they used to tease me, they called me flat-chested plains. So I always went, flat-chested plains. I'm like, I'm gonna get me some grills. Girl, I'm sitting on. So I'm like, okay. And then I had another aunt. I ain't gonna call her name. She was an educator too. God bless her soul. She had a lumpectomy. And now some lumpectomies work well for people, okay, where it doesn't come back. Because you still want to save, how can I say, what was created in you. You just want to add to.
Right.
Got it?
Right.
But then I had a wise aunt, my mom's baby sister, Aunt BJ. She had it all removed. And by the grace of God today, she's still a survivor. 20-something since years ago, she's still a survivor. So I'm like, should I be like Aunt so-and-so? Be like Aunt so-and-so. But she got, when she then came back, but then she 20-something. I'm gonna follow Aunt BJ. I'm gonna follow what I know what works, right? And I prayed about it. I'm like, But this is that time I could just get that mass reconstruction. Okay, so I told my breast surgeon, I said, take it out. She goes, you sure, but we want to see it. Take it out. All of it, remove it. I can always give me some prostheses and we fine. So she's like, okay. And so sometimes, I'm due for a visit this month for her anyway on the 16th. So she's talking about, when you gonna get that done? I said, as soon as I lose some of this and some of this, I get this fixed.
Yeah.
Because I can use some of this here.
Right.
Right.
But
I got to be up under a certain weight. So I'm working on it. So, because it's work. And so, but my point is, to have that done. So going back to the pathology of diseases in the family, going back to this, she obviously, when they did the cone method, instead of the cone method, they should have
just
gave a total hysterectomy.
to stop it, just all
Completely.
together. Yeah.
Completely.
Yeah.
In my recommendation, but I'm not a licensed MD.
Right.
That's just based under my experience as a coder and as a researcher. That's what they should have done, in my opinion. But I'm not placing regrets because stuff still could happen.
Yeah, because my sister too, she has the total hysterectomy. My sister.
Mm-hmm.
But my sister-in-law, only the cervix, they have the cancer.
Yeah. And for me, it was better now. They did the right breast mastectomy on me, but I still had my girls. But I had a huge fibroid, which made it complicated for me to ever get pregnant and stuff like that. It was big as a 6-month pregnancy, and it was growing up and pushing out on my liver. So I had to have that taken out.
Right.
And I'm glad that the OBGYN doctor did that for me because it gave me better sustainment of life. Because other than that, to take tamoxifen like I still do today, and aromasin like I was 2 months ago, I would still have to have a histogram done, and those are painful. Yeah, because they was, yeah, histogram was where they run the water, and you sitting there like you having a well woman exam, and they fill your uterus up, they bloat your uterus up, and while they bloat your uterus up, they opening you up at the same time, and they snip a piece of your tissue. Oh! I had to have every 6 months. Every 6 months. Yeah. So I did that from 2013 to December 2014. When I got my total hysterectomy, no more. And it wasn't like I wanted that. It's a long story behind that, but the fibroid was just getting humongous. So it had to be taken out. And being well over 40 at the time now, the chances of having kids, because I'm estrogen positive. So if I were to have children and I'm developing here and developing there, I'll die. So it was better that I had the total hysterectomy. Yeah. Thank y'all for letting me share my breast cancer story and how all this works. Yes, ma'am.
No, and because I have my brother-in-law sister.
Uh-huh.
She's waiting for the, no, it's really hard, you know, the person that is waiting to die.
Oh.
She has a cancer.
She's in hospice.
Yeah. She wants to go to hospice now because she didn't eat, you know, she eat like a bird, you know,
Yeah,
because the appetite
it's gone.
Right.
Yeah, yeah, the appetite is gone. Yeah, so it starts in the mind. Who is this?
My brother-in-law sister.
Your brother-in-law's sister. I'm so sorry. So what's getting ready
It
to
started with the lung. Then, no, the cancer is, but it's not a cancer of the uterus, so they take it off. Total hysterectomy. Then it came back that they saw one muscle.
Okay, a mass in her shoulder?
Yeah. Then, because that's it's lung cancer.
It traveled.
Then she went to retire, 66 years old. Then now it's waiting. Because she had chemotherapy, radiotherapy, but she has heart failure because for the radiotherapy, because second time around. And the doctor said it's useless.
I'm sorry. I'm sorry. I'm so
And
sorry.
this, they detect the cancer like 65, and they detect 66, and now it's 68. Is it 2 years? And the doctor said it only wait.
Okay. Yeah, so what she's gonna end up going, you need to get the book called 13 Stages of Death. We had the Visiting Nurses Association that came out to visit us with our dad and a pastor from the hospital system. And they gave us a book on 13 stages of death. And you're gonna adventure some of that. And I adventured that all with my dad. I adventured all 13 stages. Yeah. The bargaining stage, all of that. Yeah. It's something. Thank y'all so much for listening. Happy Pink October. Love y'all. Test time tomorrow. Test time tomorrow. Gonna take the test. Gonna pass that test.